Hello everyone, welcome to the series of sleep pharmacology. This is our fourth lecture, right? Now, in previous lecture, we saw all the anatomical position, where exactly the sleep center are, what are the types of sleep, like difference between REM and NREM sleep. In last lecture, we thought the center of the sleep, okay, we should know the hypothalamus. That is a part of brain. That is called the hypothalamus. It's the base of brain, and you already know it is near the pituitary gland. What is the function of your hypothalamus? It link nervous system to the chemical coordination, that is to the endocrine system. And below the hypothalamus, there is a limbic system. Okay, and limbic system, you already know, it control emotions, behavior, motivation, long-term memory, and olfaction also. So these are all the function of your which one? That is called the limbic system. And we already know that brain is divided into forebrain, midbrain, and hindbrain. Forebrain, okay, that is prosencephalon, midbrain, mesencephalon, and hindbrain, that is rhombencephalon, right? We don't really need to know the midbrain and hindbrain, but we need to know the forebrain. So forebrain is divided into, that is called cerebrum and diencephalon. Okay, so forebrain is divided into cerebrum and diencephalon. Cerebrum, it is also called telencephalon. It is called telencephalon. So whenever I'm talking about the diencephalon, diencephalon is a part of forebrain, that is cerebrum and diencephalon. This diencephalon consists of thalamus, hypothalamus, epithalamus, and subthalamic nuclei. So this is what I want you to know. So hypothalamus is nothing but the part of forebrain, and it is nothing but the part of diencephalon, right? And this is all about your which one? That is called the forebrain. Midbrain, everybody know what is the function of midbrain? Vision, hearing, right? So these are the function of your midbrain, and you already know midbrain consists of, will not go in a detail, the midbrain. If you know the midbrain, they are having cerebral peduncle, corpora quadrigemina. Okay, so cerebral peduncle, corpora quadrigemina, along with the cerebral aqueduct, right? And you already know the tactile part. Okay, it is the tactile part, the rear part. They have a superior and inferior colliculi. Superior colliculi and inferior colliculi. Superior colliculi and inferior colliculi. Whenever I said superior colliculi, so superior colliculi receive input from kahan se aayega? Retina, and that's why it is related to the visual function. Okay, so superior colliculi get input from retina, and then it will give to the visual cortex. So for vision, superior colliculi of corpora quadrigemina, that is the tectum or rear part, and inferior, if you see, this is the midbrain, right? This is the cerebral aqueduct. This is superior colliculi, a pair of superior colliculi, and these are the pair of inferior colliculi. Midbrain, okay, then pons, then medulla. So here on a tactile part, so they receive the input from retina. So ये हो गया आपका superior colliculi. Inferior colliculi, therefore hearing, input from hearing, or you can say auditory. Hearing and auditory. So this is all about your which one? Superior colliculi and inferior colliculi. So this is how they are all connected to the, that is called the sleep system. So in short, whenever we are talking about the hypothalamus, so I will draw, so you can remember, this is a part of the brain, and there are two centers. One is called Tmn Center and another is called VLPO Center. Okay, one is called Tmn Center and another is called VLPO Center. What is meant by Tmn Center? We are talking about the hypothalamus. So Tmn Center, it is wake center. Okay, it is related to the wake center, and VLPO, it is for sleep center. It is for the sleep center. What is meant by Tmn? Tubomammillary nucleus. Okay, so it is tuberomammillary mammillary nucleus. So here there are the cell with the nuclei, here are the cell with the nuclei, here there are the, so in total they form this structure in case of your hypothalamus. So ये हो गया आपका TMN, that is tuberomammillary nucleus. In the same way, this is VLPO. What is VLPO? It is a ventrolateral preoptic nucleus. It is a ventrolateral preoptic. Okay, this is the rear part, this is the front part. Here there is a eye, and here there is a optic chiasma, and that's why I'm saying it's a preoptic one. So ventrolateral preoptic nucleus, and that is for the sleep. That is for the sleep. So, and this is hypothalamus. This is the anterior hypothalamus. Yani this is your brain, pineal gland, and here there is a thalamus, and this is hypothalamus. Here there is an eye. Here there is an optic chiasma. So this anterior part we are talking about, it is a VLPO, and the tectum or rear part, it is a TMN part. So we are seeing this here, right? So what happened when TMN is active? When TMN is active, then there is a wakefulness, and when there is a VLPO is functioning, what happened? This VLPO induced the sleep. Okay, VLPO induced the sleep. So now we will see in short what exactly happened. When this VLPO active, these are made up of the neuron or the nucleus of the, that is called the nerve cell or brain cell. When it is active, they release a neurotransmitter which is called GABA. So they release what? GABA. They release basically the GABA, and this GABA basically released to which center? Tmn center. कहाँ जाएगा? This goes to which one? That is called Tmn center. That is Tmn center. And then what happened? This GABA basically inhibit the Tmn center. So VLPO, they release the GABA, and this GABA inhibit the Tmn center. So what is the function of VLPO? Sleep. So how this VLPO perform the function? VLPO release the GABA. GABA inhibit the VLPO release the GABA, and this GABA inhibit the Tmn center. If Tmn center is inhibited, what happen? Tmn is for wakefulness. So if there is no wakefulness, person going to sleep. This is I want you to remember. So VLPO release GABA. GABA inhibit the Tmn center, and it induces the sleep. This is what I want you to remember. There are some other neurotransmitter, that is orexin, hypocretin neuron. So orexin releasing neuron, hypocretin releasing neuron. These are related to your which one? That is called the sleep mechanism. Okay, so this is all about your which one? How the sleep is promoted, or how the wakefulness is inhibited. So if you see the day wise, as the day progress, light slowly and steadily decreases. Okay, so day progress, light start decreasing. Whenever there is a less light, secretion of melanin is increased, because melanin is a darkness hormone. So this melanin is basically which hormone? Darkness hormone, and that is why this melanin is secreted whenever there is a dark. So whenever there is a dark, it means that light decrease. It is the light decrease. So what exactly happen? As the day progresses, light decrease and melatonin secretion increases. And because of increased melatonin secretion, this melatonin go to the VLPO, suprachiasmatic. You already learned this. This is your suprachiasmatic nucleus. This melatonin stimulate the suprachiasmatic nucleus. This suprachiasmatic nucleus stimulate which center? VLPO center. Which center? VLPO center. And this VLPO trigger, and there is a release of, that is called GABA. So one more time we will see it. Okay. Look and listen carefully. What happened? So this is your brain part. So this is your brain. Here there are eye, and this is like optic chiasma. This nerve from one eye and another from another eye. Here there is a suprachiasmatic nucleus. Suprachiasmatic nucleus. You already know. Here there is a pineal gland. This is the pineal gland, and somewhere here there is a hypothalamus. Okay, and we already know this block. They contain two center. One is called VLPO center, and another is Tmn center. Right. So what happened? Look, what I said in short. As the day progress, light decreases. What happened? The light decreases because of less light. This is your pineal gland, which secretes darkness hormone, that is called melatonin. So as the day progresses, night comes, light decreases. So light decrease stimulate the secretion of melatonin. Now this melatonin, which is secreted by pineal gland during the dark time, it trigger the which nucleus? Suprachiasmatic nucleus, which is close to which center? VLPO center. Which is the VLPO center. Then this suprachiasmatic nucleus, which is close to the VLPO center, what happened? This VLPO center starts secreting GABA. Okay, so who is secreting GABA? VLPO center starts secreting GABA, and this GABA basically inhibit the Tmn. This GABA inhibit the Tmn, and you already know Tmn is for wakefulness. If GABA inhibit the Tmn, person should go for the sleep. That is what the normal mechanism which happens. So simple, when there is a darkness, secretion of melatonin from pineal gland. This melatonin stimulate the suprachiasmatic nucleus, which is close to the VLPO center. VLPO center releases GABA, and GABA inhibit the, that is Tmn center. So जो wakefulness है, it is going to the sleepiness. So this is all about your which one? That is called how the sleep is there. And in contrast, when Tmn is stimulated, when the light is more, when there is a more light during the daytime, what happens? The melatonin secretion during the daytime decreases. Because of less melatonin, there is no stimulation of suprachiasmatic nucleus. There is no release of GABA. Whenever there is no GABA, there is an increased secretion of serotonin and histamine, and that keep person awake. This is what I want you to remember. So this is how your circadian wake drive or circadian sleep wake cycle is controlled. So this is how your the normal physiology happen inside the brain. Now if you want to study this, you have to perform one investigation, sleep wave study. You already know what is that called? Electroencephalogram. It is called electroencephalogram, EEG. It is the investigation of the study. Okay. Now you already know person is in awake stage. The first stage is awake stage. Then person become drowsy. Then NREM 1, 2, 3. Okay, and after that REM sleep. So these are the stages of the sleep. Okay, now whenever you see the electroencephalogram that is related to the brain, you will see the waves. Whenever person is awake, these are high frequency. Okay, more. These are basically the high frequency, and if you see the distance in between, the distance is low. So high frequency and low voltage wave. whenever you are awake, and it is called beta wave. It is called which wave? Beta wave. Then slowly the frequency become less. Slowly the frequency become less, and these are called alpha wave. These are called the alpha wave. And then you can see the theta wave on the basis of the shape, theta wave. And then you can see the waves, they are like spindle. It is also called slip spindle. So in one you can see the beta wave, then alpha wave, then theta wave, then you can see 2 and 3 slip spindle, and then it goes to the delta wave, then it will go to the delta wave. So in REM sleep, again REM sleep is whenever you are awakening, and whenever you are awakening it is a high frequency low voltage. So here also you can see high frequency low voltage. So high frequency low voltage whenever you are awake and whenever you are in REM sleep. So these are the same here. First in REM sleep, drowsy, alpha wave, then theta wave, then sleep spindle, and then delta wave. And then in REM sleep it is the same, just like the awakening, that is a high frequency, okay, and low voltage wave, okay, just like the awakening stage. So if you want to measure the frequency, that is in hertz, like beta waves, they are like 12 hertz, alpha wave, they are less than that, right? So you can see here beta waves, it is more, so it is more than 12 hertz is the frequency. Then alpha wave, theta wave, it goes on decreasing 8, 4 hertz. So that is on. And again, delta is like here, it is like 1 to 2 hertz. So this is the frequency of the wave. So we don't go in a detail of that particular thing. I would just want you to remember the frequency of the wave, how it will goes on decreasing order. And again, it will comes to the high frequency and low voltage. Like again, here it is the more than 12. Now investigation, this is one of the investigation. If you have any problem regarding the sleep, so what are the various investigation you can do if there is any problem related to the sleep? So sleep investigation is very, before going to the diseases or problem in sleep, we will see the sleep investigation. One we already discussed here, that is called electroencephalogram. So what are the sleep investigation? First is the behavioral measurement. The first is behavioral measurement. This is one of the kind of investigation in case of the sleep study. This behavioral measurement, it is called actigraphy. It is called actigraphy. We don't go in a detail of that particular investigation. One is called behavioral measurement. Second is called polysomnography. Second is polysomno. Somno means related to the sleep graphy. So graph. So EEG is one kind of graph. Poly, it means there are so many examples come under the somnography. So one we already discussed, that is electroencephalogram. Okay, then electrooculogram, electromyogram. Myogram for what? Muscle twitching. Oculogram for what? Eye movement, right? So these are kind of various type of investigation. One is called behavioral measurement, another is called polysomnography. And you can also rule out the lesion by doing PET scan, CAT scan, okay, CT scan, MRI, not CAT scan, CT scan, MRI, to rule out any central nervous system lesion. So this is kind of the investigation you have to perform in case of sleep study or sleep problem. Now what is the disorder we are going to study in this lecture? There are so many disorders like insomnia, sleep, no sleep or less sleep, breathing disorder, hypersomnolence, parasomnia, movement disorder, sleep wake disorder. There are so many disorders we will see in case of this sleep study. So we will start looking one by one after this. So now the next is sleep disorder. What are the various sleep? So we will done with sleep, type of sleep, neurophysiology or physiology of the sleep, okay, centers for the sleep, chemical control of the sleep. Now we are saying the last part of this chapter, that is called the disorder of the sleep. There are so many disorders. We will see important one by one. The first one, everybody want to know this, that is insomnia. that is insomnia. What is insomnia? Insomnia means dissatisfied sleep. In simple word, you can say insomnia is dissatisfied sleep. You slept, but you are not really satisfied with that particular sleep, or they have a sleep problem or difficult to fall asleep. Okay, but whenever there are certain conditions, you can say it is insomnia at least 3 nights per week. Then and then only you can label it as insomnia. It's not like that today or tomorrow you don't like you are not satisfied with your sleep, or you cannot maintain your sleep, or you are difficult to fall asleep, and you can label yourself that is you are suffering from insomnia. No, it should be at least 3 nights per week, and then only you can label this is called the insomnia, right? But this insomnia 3 nights per week, it is one more thing, it is important, it is without any drug, or you can say medication. Okay, some drugs, whenever you are taking that drug, that is for some another diseases, right? And that drugs keep you awake, and because of the side effect of the drug, if you are not getting enough or dissatisfied sleep, it doesn't mean that you have the insomnia. So many a time some of the drug, they feel you insomniac, but that is not the insomnia. For insomnia, it should be a dissatisfied sleep, or you cannot maintain the sleep, or you cannot fall asleep. How? At least 3 nights per week without any drug. You shouldn't be on any drug or any medication. This is very, very important if you want to label the insomnia. The symptoms of insomnia, right? One thing is that you are not getting enough sleep or satisfied sleep. Symptoms are very like hyperarousal, right? If somebody makes some noise, or if somebody touch you, you just wake up from the sleep. That is called hyperarousal. Hyperarousal during the sleep time, and that is not a satisfied sleep. We already know that sleep should be okay. It should be deep, and whenever you are deep, there is no stimulus which can wake you up. But if you are insomniac, hyperarousal is the first and most important. When there is a hyperarousal at bedtime, you are in bed and you are not sleeping well, you are aroused easily, that is the hyperarousal. That is one of the most important symptoms. Second is muscle cannot relax. Your muscle not feel relaxed. This is the another symptom. You feel like pain in your muscle, or it's like a constriction of the muscle, but it's not a relaxation. Not relaxed muscles and hyperarousal, these are the two symptoms of the insomnia. Now, sometimes this insomnia, it is also related to some medical condition. If that person suffering from some another diseases, that diseases also give rise to the insomnia, like chronic obstructive pulmonary disorder. Okay, patient is not breathing well and it is a chronically ill, so because of that, what happened? Patient feel insomniac. Asthmatic patient, COPD patient, asthmatic patient, right? Benign prostatic hypertrophy. In case of male, what happens when there is a benign prostatic hypertrophy? There is an increased prostate size. Person has to wake many times for the micturition or urination. In BPH, there is the most important symptom is increased frequency of micturition. You are sleeping, but you have to wake up for that particular urination. So what happened? Your sleep is not completed, and that medical condition also give rise to the insomnia, right? Then GERD, gastroesophageal reflux diseases. Whenever you are sleeping, right, what happens? If you feel the reflux from your esophageal sphincter, your like that is cardiac sphincter or gastroesophageal sphincter is not proper, what happens? There is a reflux of acid from the stomach, and because of that you feel acidic and you just wake up because of that hyper acidity, and that is called gastroesophageal reflux diseases, right? If there is any muscular disease like fibromyalgia, pain in your fiber or muscle fiber, right? Menopause, during the menopause also because of the hot flushes, because of the hormonal thing. These are the medical condition person can feel insomnic. So these are the medical condition. Then there are certain psychiatric condition, okay, in which person can feel insomnic. Whenever you are not feeling to sleep, the most important reason is depression. You are like major depression is there, and because of that you are insomnic, right? So that's why I separate the medical condition from the psychiatric condition. That is the major depression. So these are the reason, medical reason and some psychiatric reason. Depression, that is called anxiety disorder, okay, anxious, tomorrow is the result, and what the result, or might be result is after 1 month, right? But you cannot feel sleep because you don't know how much marks you are getting. So that is the anxiety disorder, depressive disorder, PTSD, very important, right? Post traumatic stress disorder, something bad happened, okay, that is because of that particular trauma. Is not like actually it is a trauma, it can be anything, right? Somebody is dead from the family, and that is a trauma to that particular insomnic patient, and because of that trauma or because of that particular traumatic stress, patient are not able to sleep. So this is called post-traumatic stress disorder, right? Sexual abuse. These are so many conditions in which the person feel insomnic, okay? So schizophrenic patient, they are also insomnic, but I want you to remember major depression, anxiety, PTSD, and the sexual abuse. So this comes under the psychiatric condition, and that is why that person, medical condition and psychiatric, they feel the insomnic, okay? Now, what are the other reasons? Medical condition, psychiatric condition, substance. Some substance makes you insomnic. So which substance you should avoid if you want to sleep well, if you want to recover your metabolism, if you want to live life healthy, and if you don't have these two problems, but some substance is there, you are using that substance also make you insomnic. What are the name of that substance? This is very important. The first is alcohol. Okay? So if you are using alcohol, that makes you insomnic, right? Caffeine, that is coffee. That is why people usually don't recommend to drink the coffee like 4 hours before the going to the bed, right? 4 to 5 hours, because the caffeine effect is up to 4 to 5 hours or more than 5-6 hours. So usually it should be avoided. So caffeine makes you insomnic. Alcohol, caffeine, nicotine, direct nicotine or in the form of smoking. These are the substance which makes you, that is called the insomnic, okay? Antidepressant drug, like antidepressant drug. If somebody is depressed and we want to make it happy, we are giving the antidepressant drug, but that antidepressant drug also makes person insomnic, okay? Then dopa agonist drug, beta blocker drug, if somebody is on beta blocker, so we will make the separate heading, drug. Medical condition, psychiatric condition, substance, alcohol, caffeine, nicotine, drugs. Okay, what are the drugs? We already discussed. The name of the drug is dopa agonist, beta blocker drug, dopa agonist drug, antidepressant drug. So these are the kind of drug which make the person insomnic. So these are the reason. Might be medical condition, might be the psychiatric condition, substance abuse, or you can say drugs, they makes the person insomnic. Now the last part of this particular insomnia, treatment. How will you treat? You know how to treat this. Stop taking alcohol, caffeine, nicotine, but you cannot stop the drug because they are for your medical condition. So we can adjust the doses of this drug. What about this medical condition? COPD, BPH, GERD, menopause. So here you can change the lifestyle. Major depression, you have to treat the major depression, anxiety, and that's how you can treat the insomnia. But still, you can use certain drug for insomnic treatment, right? So what is the most important drug which is used for the insomnic treatment? The first drug is very important. That is benzodiazepine receptor agonist drug. Benzodiazepine receptor agonist drug, not an antagonist. It should be a agonist drug. Okay, that is called Zolam. We said like triazolam, this Zolam, right? So one of the example is like triazolam, alzolam, right? So this Zolam drug, they are benzodiazepine receptor agonist drug, right? These are the drug we can use in case of insomnia, so that if they are agonists, so benzodiazepine, what happened? They makes you sleep. They makes you sleep. So these are the one treatment in case of insomnia. Second is tricyclic drug, antidepressant drug we can use in case of the insomnia. Tricyclic drug, right? And third drug, I don't know whether you know this drug or not. These are called melatonin receptor agonist drug. Melatonin receptor agonist drug. Why you want to use the melatonin receptor agonist drug? Because insomnia, no sleep or less sleep. If you want to sleep, what happened? Which hormone should be there? Darkness hormone, melatonin should be there. And this melatonin, you already know, act on a VLPO center, and that VLPO center release the GABA and first makes you sleep. So if this is not working properly, give the melatonin receptor agonist drug. This is what I want you to remember. Melatonin receptor agonist drug. There are so many melatonin receptor agonist drug. Okay, that is called Ramatalin. Okay, so these are the example of your which one? Melatonin receptor agonist drug. And then you can also try antihistaminic drug or barbiturates for the treatment of insomnia. So this is your first disease I want you to remember whenever you are dealing with the sleep study or sleep pharmacology, right? So benzodiazepine, you already know, that is called short acting benzodiazepine receptor agonist. Usually it should be a short acting benzodiazepine receptor agonist. Melatonin receptor agonist, I want you to remember, that is called Ramelton. What is the example? Ramelteon. Ramelteon. Ramelton is the example of melatonin receptor antagonist drug. So this is all about your which one? That is called insomnia. So this is the insomnia. Anything else you can do in insomnia? How to treat? Usually people forget this treatment. This is called sleep hygiene. And now what is sleep hygiene? We know the hygiene, cleanliness. What is sleep hygiene? Okay. So sleep hygiene doesn't mean you have to wash and no. That's not about the sleep hygiene. What is sleep hygiene? Avoid nap. I want you to remember the sleep hygiene, very important. This is in your control. Sleep hygiene is in your control. Substance is in your control. So you can take care of insomnia by doing this too. I know this is not in your control, like these are the diseases, so you can use the medical line of treatment, but this any person, any normal person can try the sleep hygiene and avoidance of the substance. So sleep hygiene, what is sleep hygiene? Avoid nap. Usually people take the nap, like if their time bedtime is like 9 or 10 p.m. or 11 p.m. they take the nap, intermittent nap. So nap is like 30-45 minutes sleep, and you already know that at least you should require 3 to 4 hours of the sleep to go through your whole, that is called sleep cycle, that is NREM sleep. But they usually take the nap of 30 and 40 minutes, so they didn't finish the sleep cycle, or not a single cycle, right? So in this 3, 4 or 5 hours you have to finish like 2 to 3 cycles so that everything functioning normally. But nap is not nap, it basically rest. People sleep at the end because they are tired. So you should avoid this nap, first thing. Second, exercise regularly. Exercise regularly, that is one come under the sleep hygiene, right? Then no caffeine. I will make it in red color. No caffeine. Lot of people, they are not happy because of this no caffeine, right? But there should be a no caffeine. Nap should be avoided. Exercise should be regularly, right? That is a good thing, right? But caffeine also should be avoid it. And nicotine and alcohol, you should avoid this. This is sleep hygiene. What is sleep hygiene? Usually you feel that sleep hygiene is some cleaning thing. No, it's not a cleaning thing. You have to clean your body by the toxic waste, and that toxic waste is clean only during the deep sleep or sleep time. And for that, you have to avoid the nap, exercise regularly, and caffeine. So this is the first and most important disease that is called insomnia in case of your sleep pharmacology. So here we stop, and in the last lecture, like the part 5, we will see all the diseases and their treatment, right? So why I took insomnia? So that you should know how insomnia is important, how they makes your life more miserable, right? Because of usually these are the diseases you can see in a senior citizen usually. But what about this one? This is in your control: alcohol, caffeine, nicotine. You can avoid nap, exercise. And I already told you, young generation or youth, they are suffering from the insomnia. So I don't think benign prosthetic hypertrophy or asthma or all this menopause thing, they are in young generation. So forget about the medical cause, psychiatric cause. Okay, think about the substance. Right? Sleep hygiene. So that's how you can make your life more and more happy. So another diseases we will take in a last lecture of your sleep study. Thank you.